Hi, I'm Professor Ata from ART Fertility Clinics in Dubai. I'd like to talk to you about the fresh and frozen embryo transfers. In the past, like long ago, the standard of care was a fresh embryo transfer because freezing and thawing wasn't that effective. And that was the reason why people were given multiple embryos, like 2, 3, even 4 on some occasions. And then that's how they ended up with multiple pregnancies and preterm deliveries. Over time, as freezing technology reached its current status, in a good lab, in good hands, cryosurvival, which means the survival rate after freezing and thawing for embryos is almost 100%. I mean, something like more than 99.99% at the moment. So now we are not afraid of freezing, and sometimes it's even better to transfer a frozen embryo than a fresh embryo. Examples are when you produce many eggs in one cycle, the hormone levels are increased with an adverse effect on the womb. So if you transfer a competent embryo just a few days after egg collection when the hormones are still high, that embryo is less likely to implant and reach live birth. So if you allow the ovaries to shrink, the hormone levels to come down in the next cycle, and transfer the same embryo in a frozen embryo transfer cycle, that embryo is more likely to reach live birth. So that is one. And this effect is always there regardless of the number of eggs. I mean, the higher the number of eggs, the more the effect. Secondly, pre-implantation genetic testing is used more often nowadays, and to get accurate results, we need a few days. So to ensure the embryo that is transferred is in perfect synchrony with the womb, it is easier to do it in a frozen embryo transfer cycle rather than trying to rush it in a fresh cycle. So, I mean, I can count other reasons, but in general, today, with such effective freezing technology, in most cases, especially when you produce a good number of eggs and if you're undergoing genetic testing, frozen embryo transfer fares better than a fresh embryo transfer.